Okay, that completes the demonstration on the MediWraps and the laser. And as you saw, we worked on the kneecap to the rib cage area, which is what most of the people around the country are doing with the lasers. Let's take it a step further. This can be a completely additional avenue for revenue for you as well. A lot of the customers are going to say, well, it made my skin feel soft, I've lost inches, I've been detoxifying, why can't I have the other parts of my body also the MediWrapped? There's no reason they can't. As a matter of fact, you can do that, and in some cases, a lot of the locations actually charge additional money for that. They'll charge additional money for doing the whole body with the MediWrap. The main thing is that wherever you put the MediWrap, they're going to be tighter skin, softer skin, less inches, and detoxification is going to be going on. So basically that's about it. And like I say, you can do the MediWrap and do the whole body, and it's an extra source of income as well. And you can even suggest it to the people if you'd like. Okay, without further ado, we're going to bring Judy back on and Victoria, and they're going to do the process of showing you how to do the entire body in case some of your customers would like that, and they will.
Alright, so in order to do the full MediWrap, we'll start off right at the ankle. Go ahead and face the camera. Have them step shoulder width apart, or maybe a little more if they have thick thighs, so that there's enough space in between to work. But as I said before, you're going to wrap towards the midline. An upward angle on the limbs. You want to move fairly quickly to keep the heat, and be sure to overlap each wrap about 2 inches, almost to halfway. Get up to the top of the thigh and tuck.
That's still quite comfortable, so that should still maintain the same tightness as you did the first wrap?
Yes. Okay. The tension on the limbs should be firm, but not too tight. And you don't want it to be too loose either. Okay. Okay? So go ahead and switch spots with me. There you go. Now for demonstration purposes, these are dry wraps. Of course, they will be soaked in the vitamin mineral solution when you're using them.
Now with the legs, that one still feels the same tension, but I know that there's times that it might feel a little looser. What would that do?
It really wouldn't make all that much of a difference, but you do want to make sure that the tension is very much the same in each leg.
Okay.
And one thing that you want to do is, as you did before with the wrap, you're going to put it on as you're wrapping and make sure you maintain the heat. Of course, right now I'm just going to go over the wrap.
Now I know we've done the wrap another time, and we hadn't put the suit on as quickly, and that got cold very fast.
Yes.
That wasn't very pleasing.
No. And one thing that your patients will notice is that when they come out of the wrap, it's going to be a little chilly. You might want to warn them of that.
Now, do they...
And have a towel or a robe next to them in case they need that. Alright, so go ahead and face me while I do the skirting. I like to unwrap mine a little bit so that I can just kind of crouch down, swing the wrap around, straighten it up, and then kind of go right up under the butt, bring it to the side, secure it, and then continue to wrap. I like to use proper biomechanics while doing this so that I don't create a lot of lower back pain for myself And that's very important. You don't want to hurt yourself doing these procedures. Again, you're going to alternate directions here. And if you stay in one spot as you're wrapping, ooh, careful there, stay in one spot as you're wrapping, you can wrap more quickly and not tire yourself out so quickly also.
Now when you have a large person, will it become necessary to walk around them a little bit more?
If they are too large to reach around them, and I've worked with some very large people before, and of course I have short limbs, so sometimes I might have to lean a little more.
Okay.
You know, just lean. But however, if they are much bigger than your ability to lean, then you would have to step around and, of course, modify things as you need to.
All right.
Okay. Go ahead and bring your arms back up. And again, you can see I'm going straight across the back, about halfway over the last wrap. I'm going to secure it and keep going in the crisscross on the torso. Now once you reach right under the breast, you're going to use a different technique. Go ahead and face them. Alright, so I've already secured the wrap, I've come around once. Now I'm going to go right up under her breast, right over her shoulder, and then I'm going to come and cover her lats. And go straight across her nipples, and then tuck completely.
Now, with that effect, how long would that maintain, lifting up the tissue?
It will stay. It will lift the tissue. This technique is going to work kind of like a breast lift. It's going to lift and firm up that tissue, which is very beneficial after maybe having a child, losing a lot of weight, things such as that.
Or becoming past middle age.
That too.
Gravity changes.
Of course. So, we're going to
Yes.
switch direction here. Okay. You're going to go over the last one and secure it. It'll come up on this side.
Make sure that nothing drops.
Yeah. Keep everything in place. Very, very important. Okay, go directly across and see how I've ended right in her cleavage. I'll allow her to tuck this one. So tuck it entirely in between the wraps. There you go, just like Grandma used to do with her change.
And the tissues. Can you wrap the breast?
Bare?
Bare?
Yes. Yes.
Now, that's more effective?
It is if that's something they want to focus on. Again, a lot of things are going to vary from client to client, so you really have to use a lot of judgment and, might even say, common sense.
Okay.
So go ahead and bring your arms back up. Well, a little lower. We're going to go ahead and begin with the arms.
Now, is that going
Now.
to tighten the under area also?
Yes, this will also help firm up any loose tissue in here. And the direction of this wrap can also vary. Personally, I find comfort in going in an outward direction, away from the midline. But for lymphatic purposes, you will wrap towards the midline. So that is something that you can determine with each client or just with your procedure in general.
Now, this would help some cancer patients too, wouldn't it?
Mhm.
Because the lymphatic
Yes.
system works a little slower.
Mm-hmm. Yeah. So going out will allow you to do a crisscross in the back to cover the shoulder blades. Go ahead and bring that back up. Okay. You'll go all the way to the top of the shoulder, and then go ahead and face this wall here. There you go. And you'll go across and under the arm and come back around. You'll go right up under the breast and then tuck wherever you end. In this case, it's right up under her arm. Okay? Now I'm going to do this one, I'm going to do this one opposite for the lymphatics. So if we're going to go towards her midline for lymphatic purposes, once we get to the top of the shoulder, and also doing the arms, you're not going to want to use any resistance whatsoever. With the legs, you can get away with tugging a little tighter. This will cut off circulation very easily and be very uncomfortable very quickly. So you want to make sure that you're just kind of keeping the wrap from being loose and falling.
So no
No
fingers.
tension.
Okay.
No tension whatsoever. And when you reach the top of the shoulder, you're going to do a crisscross a little differently in the back. And go ahead and turn around for me. Whereas we got to the top of the shoulder on this side, and it's going down to cross over the shoulder blade. This way, if you're doing the opposite direction, it's going to come up and cover it this way, and you're going to go over the shoulder and under, and it will cross the back rather than under the breast. You see? So, whichever option you choose to do, that's the differences for the back. Any questions? The chin. The chin is another area that, as we age, tends to loosen up and droop.
Yes.
So there's an option to wrap the neck and face to kind of give a little facelift.
Like a lift without pain.
Without any invasive procedures. So what you can begin doing is going right up under the chin, right here. You don't want to cover their mouth with it, and go right over like this, rather firmly, so that it picks up whatever loose tissue is there, and you go over the top of the head and come down right aside the eyes, and this will help chisel the cheekbones and jawline as well. And once you get that, you can loosely drape it around like so. And each suit will either zip up and cover this area, or the pullover top will also keep it in place, and you can tuck it in where the shoulder ends right here. So you can adjust that if you need to. Just a little. There you go.
Right.
Comfortable?
Yes, I am.
All right.
It's nice. You can feel the lift.
Yeah, everything's in place, secure. And then you'll go ahead and have her step into the suit. Make sure you hold on to me so you don't fall over.
Okay.
There you go. See? So everything is covered, everything's secured. And if you want to maintain heat or moisture for the face wrap, you can use a saran wrap, or I generally just take it off about halfway through, because after about a half hour of being around the face, it tends to become uncomfortable, a little claustrophobic for some people.
Mm-hmm.
So it's entirely up to you, your option.
So you're on your way to weight loss.